Om Dham Dhanvantare Namaha. Nagadirogan Sadatan Shaktan Visheshakayan Prasatan Sheshan Ausukya Mohan Ritan Jathana Yopura Vaidhyaya Namosutasmai. Synopsis writing. To start the study of clinical research, clinical study, we have to first write the synopsis and submit to the university for registration. So, synopsis components are title, author with affiliation, guide, co-guide, department, institution, and university. The first page, this will be there. The title, the title of the thesis written, followed by the author with affiliation. It is a PG student, and his guide with affiliation, co-guide with affiliation, department in which research is conducted, name of the institution, university. Here. So after that, these points are to be written in the synopsis. First is need for the study. Need for study, why the study is relevant to the present context or scenario. The relevance of the topic to the present scenario and what are the advantages of the outcome of the research, and a brief introduction about the research work and also the outcome, how outcome of the research is every advancement in existing knowledge that has to be mentioned, and what is the need of the study in the present system is to be mentioned. Then review of literature. In the review of literature, the description about the disease and the drug or treatment has to be given. The references from which the formulation is selected or the treatment is selected, and where is the reference of that treatment in the given disease that has to be highlighted. Suppose single drug is there, we have to give the references of the drug explaining the effect in that particular disease. Then hypothesis. Hypothesis, null hypothesis, and alternate hypothesis are to be written. The null hypothesis, it is stated that your drug or treatment is not effective in that particular disease. Alternative hypothesis, suppose you are doing a comparative study, so drug 1 or the test drug, it is stated in hypothesis 1, test drug has more, the test drug is more effective than the standard drug. That is the hypothesis 1. Hypothesis 2 is the standard drug is more effective than the test. Then comes the previous one. So we have to enlist the previous thesis titles of that on the disease which you are doing the research. That has to be written in the chronological order. Author's name, disease title, university, and the year of work. That has to be mentioned in the chronological order. At least 5 researchers, the outcome has to be mentioned. Next, aim and objective. What is the aim of your study? So, primary objective and secondary objective. So, for example, in the title, if the title is the the effect- study, effectiveness of uh, Poshkaradi Kashaya in Samakashwasa, that is chronic bronchitis. The primary objective will be the interpretation is study of interpretation is of the first the Samakashwasa. And secondary main objective is study to evaluate the effectiveness of Poshkaradi Samakashwasa patients. Or one more, if a comparative drug is taken, then the comparison of the effectiveness of Varshalajikvata and Pushkaramanasava in Dharmakashasa surveys from Kerala, or maybe also the comparative study of Varshalajikvata with Dashmulakatatrayapata in Dharmakashasa patient. This is a reference to chronic bronchitis. And materials and methods. That source of data, source of patients, source of drug, selection criteria, inclusion criteria, exclusion criteria, and diagnostic criteria, and investigation. So many points are there. We'll come by one by one. First, source of data. First, you have to mention that what type of study is there, how the case is selected, how they are grouped, and what is the intervention, etc. Source of data, source of patients. Suppose you may be taking the IPD, the patient from OPD and IPD of particular hospital or from free camps. Then source of drug, the ingredient, each ingredient of the drug formulation is taken from authentic source and is authenticated by R&D department or the relevant department of the particular college. And then it is prepared by following standard operative procedures. And it may be standardized also. Selection criteria. Selection criteria, what are the inclusion criteria? What are the exclusion criteria? Whether it is randomized, blinded, these has to be. What are the diagnostic criteria? What are the investigations done? These are so inclusion criteria. So what are the criteria to include a patient in your research? Exclusion criteria means what are the criteria to exclude the patients from your research? Diagnostic criteria means how you diagnose each patient with that particular disease, depending upon clinical features, presenting clinical features or laboratory investigations or physical examination. You can diagnose and you can take the patient. Investigations, what are the minimum investigations that have to be done in each patient? For example, for diagnosis and also for exclusion of other diseases. This is very much essential. Then type of study. What type of study you are doing? Clinical effectiveness, randomized, single blind, case control study or control study. So randomizedly controlled clinical study. So like grouping. So you are grouping. Suppose 40 patients you are taking. It is divided into two groups. Group A and Group B. Group A usually given with the test drug. Group B standard drug. Dose and Anupana. What is the dose of your drug? And what is the Anupana? Which is to be followed with the drug. Suppose Paushkaraj Kashaya, Anupana may be Jala. Duration. What is the duration of treatment? Study. Usually 30 days. So duration. And one more follow-up is done after 45th day. The usual procedure. So you are taking the data at the point of the beginning of the treatment, next 30 days after the treatment, and after 45 days, one more follow-up is usually done. Written patient consent. Written patient consent has to be taken before subjecting him or her to the research. So patient consent form will be there, and in that local language and English, the uh, text is written that stating that the patient is undergoing so and so treatment, is no and is explaining treatment and is agreeing for the research work, and also is free anytime to stop the research. The research. Then parameters of assess how to assess the results or outcome. There are two types of them, objective parameters and objective parameters. Subjective parameters usually the symptoms. Objective parameters, science and laboratory tests and questionnaire. Just for example, in case of Sandhigata subjective parameters may be Sandhishota, Sandhishula, Akuncha Prasanaya Savrati Savedana, and non-stiffness. Objective parameters, radiological evidence, and visual analogy scale. Objective parameters. In case of obesity, subjective parameters may be uh, speak chalatva, udara chalatva, stana chalatva, Svedadikya, Durgandhya, Durbalya, Atikshu, Ativipasa, etc. And objective parameters are um, body weight, body mass index, chest circumference, arm circumference, thigh circumference, and weight, chest hip ratio, thickness, skin fold thickness in the triceps and biceps, and serum total cholesterol and lipid profile. These are the objective parameters in obesity. Statistical method for which type of statistical method is followed for evaluation. Example, within the group, pre-test process, you shouldn't test paired, and between the group, unpaired test. Or in some cases, between the group, the Wilcoxon ransom test, and between the group, that is the man Whitney test. Depends upon the type of data. Then dropout criteria. What are the criteria to drop the patient from the study? Suppose he develops some adverse reactions, he may not be able to continue, then it is dropped. Concomitant drug diet and regimen. What are the concomitant drugs, diet and regimen that is advised to patient? Example, in asthma, may be on Therifal tetratabs, but may be continue if he is taking for longer time. And diet will be is advised to avoid cold things, ice cream, and fried things. And regimen is advised to not to do excessive exercise. It will be a concomitant drug, diet, and regimen. Possible adverse drug reactions and compliance. What are the possible side effects after giving your treatment that you have to mention? And what steps you take to counter these side effects that has to be mentioned. Right. Reference. You have to give reference on Vancouver's side. The referencing is done. For example, if the reference is taken from a journal, you have to write the author of the paper and name of the title of the paper, journals, volume, issue, and publishers total page. That chapter. If you are taking from a chapter of a book, then you have to reference. You have to give reference like author's name, initials, title of the book and publisher's name, edition, volume, year of publication, and the place of publication, year of publication, total page and actual page number. Then next point is human intervention is necessary or not. That you have to clearly mention. Because you are doing animal study, then CPC, SEA, that you have to take permission. Ethical clearance. You have to get the ethical clearance for submitting the synopsis. So the ethical committee, in the front of the ethical committee, you have to present your synopsis and they may say some to make some changes. You have to make changes and get the ethical clearance number. And you have to mention your synopsis. Then you have to complete these following points, like the signature of the student, signature of the guide, signature of the co-guide, signature of the HOD, and signature of the principal or dean. Then you can submit to the university. Today, we have discussed the synopsis writing.